In November 2014, about a week before Thanksgiving, my stepmom was driving home from work and another driver swerved into her lane and hit her head on. And she was airlifted to the hospital. She had a skull fracture, a lacerated liver, a broken leg, and traumatic injuries to both of her feet. And we spent the next week in the ICU, at which point she was then transferred after numerous surgeries and great improvement to an orthopedic unit. At that point, we saw that she was getting much better, and then something happened that surprised us. She started to be confused. She was having trouble breathing and she wasn't making sense. So we told her nurse, who called the doctor, and the first day they told us it wasn't anything to worry about. They didn't take it seriously. The second day, when it persisted, we again emphasized that she just wasn't acting like herself. She wasn't making sense. And so they called the doctor and decided they would increase her oxygen. By the third day of this behavior where she just wasn't lucid and we were getting really concerned, we were at our wits' end. And finally, we were able to convince someone, one of the doctors, to really look at her, and they discovered that she had a collapsed lung. They had to take her in for an emergency procedure and put in a drain. And this was all very concerning. I'm not a clinician. We don't have doctors or nurses in our family. And it really struck me at that point that even though I might not be a nurse, I might not be a physician, I have valuable information to add as the family member to the care experience, that what I'm looking for to reduce my suffering, to reduce the suffering of my loved ones, is to be heard and to be able to be a partner in that care, because we're there many hours every day and we know this person so well. They're not just a patient, it's our loved one, and we can provide that valuable information that really adds to the care experience. So that really brought it home for me, that experience, the value that we can add if we really partner with our patients, and also brought home really that personal side to all of the data that we're collecting.